I see people are still entering. So those of you, you see something on your screen, the webinar is being recorded. You just have to consent to continue. You are not being recorded. I'm the one being recorded, but we just want you to know it's being recorded. So please click continue so we can proceed. And I'm going to start with some housekeeping items. We still have people joining us. So a couple of things. Thank you for joining us. Good morning, everyone. I hope you're all well and your loved ones are well and safe. You've clicked on the poll, so I appreciate that information. You've also clicked continue so that we can record the session. Just so you know, it's just to inform you we are recording. In the email you received with the link, you also received links for 4 resources. So I hope that you saw those at the bottom of that email. There is a PowerPoint with 2 slides per page, so they're large enough that you can see the content. We sent you a basic Charting the Life Course portfolio, the integrated STAR that some of us in Ohio developed for social distancing, and also the medical form from Stony Brook. So you have those 4. We're going to use the chat function for questions, so please feel free to type in your questions at any time. And we have a comment about accessible, so I know we'll follow up with that, Jason. I want to know a little bit more. We'll follow up with you about that. I'm not going to constantly check the chat function because I want to get through the content. We have Tracy and Aaron from the Nysonger Center at The Ohio State University helping facilitate this, and they may break in with questions. So please use the chat function for your questions. Also, please complete the poll. We're at 127. I'll check with the numbers back in a couple of slides and we'll see about closing the poll. We only have an hour today, so you may not hear everything that you want to know or you need to know, and I know that. It's only an hour, so please let us know if you want more information in the future. I'm going to be talking about the now normal, not the new normal, because I don't know what the new normal is going to be and everything changes. So I'm just going to talk about the now normal. So I recognize a lot of the names of people who registered. It's good to see you again. Let me share, and I'm going to minimize my picture because I need to see my screen and would like to see my screen. So a little bit about me. You know that I had 2 brothers. You know that my youngest brother, Nick, had a developmental disability, but he did not receive services from the DD field until he was in his mid-20s. My brother Jim had an acquired disability in his 30s and never received supports from any system. I've worked in the field for over 40 years, and I'm going to also add that in the past 2 years, 2 of my family members, my mother and my partner, both had strokes within 60 days. I share this information to tell you that I have used Charting the Life Course and person-centered thinking in my own life with all 4 family members who have disabilities. They had a whole range of disabilities, and I have also used the tools with myself because having 2 members have strokes in 60 days where I am the principal caregiver, I needed to use some of those tools for my own sanity and my own mental health and to see what supports I have. In this hour, what I hope to do is share some information about Charting the Life Course and person-centered thinking tools, how you can use them to problem solve. Please know that the principles of Charting the Life Course and person-centered thinking are universal. They were developed to be used across the lifespan. I've seen them used with people, with infants as young as under a year old, And the oldest that I know are people in their 90s. Maybe you have experiences with people older than their 90s, and God bless you if you have. That's awesome. I want to show you some examples of how to use and apply the skills and tools. I really want to focus on using the one-page description, not just related to COVID, but for any hospitalization. And also how to use the one-page description when there's unknown or new caregivers. I like this slide because we want, during this time, we want to be able to support and empower people receiving supports and their families. And we need to remember that in Ohio, 65% of people with intellectual and developmental disabilities live with their families. We need to remember when we talk about person-centered and charting the life course that it is an inclusionary approach. There are no exceptions. So comments like, but I work with people who are exclusionary, and that is not really a valid belief. You can use this with anybody. I hope during the hour you also find ways to use these skills and tools with people you're supporting, people you love, and maybe even for yourself. Tracy, is it possible to see the poll results? We have about 140 people on, so I can see who the audience is. Okay. Wow, 87 professional. Awesome, okay. Leave it up for a minute because I'm writing them down so I can keep track of who is here. I appreciate it, everybody, for answering this. Oh, awesome. So 50% of you have attended PCT. 50% of you have written a one-page description with someone. Awesome, awesome, receiving supports. Thank you, I appreciate that, Tracy, and I appreciate all of you responding. That helps me a lot. The core concept of charting the life course is that all people and their families have the right to live, love, work, play, learn, and pursue their life aspirations in the community across all life stages from birth to death, across all abilities. So just remember, in the training, those of you who have attended and heard us talk about charting the life course and person-centered thinking, we also emphasize you should not use the tools with anybody until you use them on yourself. So during this call, I'm going to also prompt you to think about how to apply it, the tools, to yourself. One of the tools in charting the life course is called the trajectory towards a good life. And we all know that 2 months ago, our trajectories were probably very different for what a good life would look like. This is a generic one for pandemic, just things to keep in mind. We all know, those of you that are professionals, family members, you all know that our #1 focus is staying healthy and safe, keeping the people we support healthy and safe, but also ourselves. We also know the importance of technology right now. We've had to adapt and create new rituals and routines. I'm not going to ask how many of you are dressed professionally, those of you that work in the field. I am, from the waist up. And also we know it's important to take time for ourselves. We also know that the #1 concern for everybody, family members, people receiving supports, and professionals, is if someone becomes ill, becomes hospitalized, or if the people taking care of them are hospitalized. Please remember that a good life is not services and supports, but what that person envisions as a good life. Also, remember that when you are working with people to identify a good life, and I think we need to have that conversation again with people in this now normal, because maybe they have changed what makes a good life. We state the things as we want to see them, not using the verb will. When we write an outcome or a good life using the word will, the verb will, we also open ourselves up to find excuses versus when we picture what we want. So there's a big difference between me saying, I will lose 20 pounds this year, and I will weigh, and my good life is I weigh 20 pounds less. And we want to not show it as a pie in the sky, but what will it look like? So what is a good life? We use a lot of cliches in our field. So what is a good life? A good life is that we have dreams. A good life is we have people who believe in us. We have what's important to us, that we are respected as contributing members of our community, that we have more good days than bad, and we feel healthy and safe and have control. Right now, the focus has been on keeping people healthy and safe. We need to broaden our scope and say, do we really know what's important to them? We've kept them busy. We've kept them active, doing different things. But now we need to look at what is really important to people. Here is a blank trajectory. You also have a copy of a trajectory in your portfolio that we attached. Again, we need to I think we need to rehab those conversations with people. What is a good life? We don't know what services and supports are going to look like, and we certainly can't find a good fit for people if we don't know what they really are looking for. So I want to share a little bit, a story. A friend of mine has a son in his 30s who receives supports, and she was gracious enough to include some of us in a live Facebook conversation that she had with her son. I will tell you, she is a trainer in person-centered thinking. She's also a mentor, and she's also a Charting the Life Course ambassador. But she realized that her son, who worked a couple of days a week, volunteered, was active in his church, all of that stopped immediately when her state went on shutdown. So she had a conversation with her son, gave us the opportunity to be part of that, and asked him, what is a good life? And he said, you know, going to work. And she said, well, what's important about going to work? We all want a job, but what does that job get us? So having those more in-depth conversations. As she had that conversation and asked him, what's important about your job? What do you love about it? What do you miss about it? Then he started naming, I miss these people. She said, what do you love about your job? And he said, I help people. She goes, yes, you do. You have a job where you help people. And as she had that further conversation about his volunteer work, what do you do? He says, I go and call bingo once a week at this place. And she said, that's assisted living. So it's important to you. Why is that important? And he goes, because I help those people and we have fun together. Okay, so it's important to you. And then he named a couple of people. As she was gathering this information through a conversation, there was no checklist. Trust me, there is no checklist for having a conversation. She identified what was important to him. She said, what else is important to you? And he goes, I miss my friends. He and a couple of friends have game night, like once a month, and they go to each other's house and they play games. Okay, let's put that down. As she then identified what's important to him, she also had to identify what's it going to look like now. And she took that information, then used the integrated STAR, which I'm going to go through, and identified what supports they have, what supports they need to get, and then identified a schedule. She actually had paper behind her and actually wrote Monday through Sunday and said, you miss people, so what can you do? I can call them. I'm going to call my boss every day. She said, maybe calling your boss every day is not, he's probably somebody you shouldn't call every day. Who can you call every day? And he said, you. And she said, yes, they don't live together. They live next to each other. And they actually built a schedule of a meaningful life for him based on what was important to him. He didn't use Facebook Live before. He did not use Zoom before. He is now hosting every week a dance party where he has a friend who is a musician who takes live requests and will play songs and People can sing, dance, just listen, whatever they want. A couple of weeks ago, he also invited me to play bingo, which I haven't played for decades, and included people from the state of Washington, and I think I was the furthest east in the Northeast Cleveland area. So she has built a schedule based on what's important to him, and looking at those things that occurred 60 days ago are no longer available. We have to create new rituals and routines, new meaningful activities. So let's talk about the integrated STAR. Some families have used the integrated STAR to figure out, what are we going to do now that we're home? And maybe you actually looked at the integrated STAR when you started quarantine and working from home. We use the integrated STAR to problem solve and brainstorm. And there are 5 areas of support. We use all 5 areas. If you're problem solving, you are probably using the 5 areas without even thinking about it. And we need to look at options. It helps us look at options, opportunities, and be creative. So I'm going to go through each section. And as I do, I want you to think about for yourself, what did you look at as far as quarantine and working from home? We always start with personal strengths and assets. Charting the life course is an asset-based approach. So we always start with, what personal strengths and assets does the person have? So think about your own life. Sometimes people split the sections and will write current and future. How many of you working at home, when you first started working at home, were able to focus? How many of you had to work on, how do I set up this schedule? How do I know when I start working? How do I take breaks? How do I stay focused? How do I know when to finish? Or has work at home become an unending workday for you? So what skills did you bring? What skills did you have to develop? I have a friend on Facebook who, when she started working at home, couldn't find a place where, when she needed the quiet, she didn't need it all the time, but found a closet, and on the closet door posted for her kids, "Don't knock unless you're bleeding or need to go to the hospital." And when that sign was up, they knew she needed to have that quiet time. Think about the relationships. Who's helping you during this quarantine? How many of you have 4-legged coworkers at home that all of a sudden are going for lots of walks because you need a break? And it's like, oh, I got to get some fresh air, I'm going to go out. How many of you are accessing friends to help you with some of the things to do at home? Maybe acquaintances, maybe they are, you're doing things in your neighborhood, you know, the neighborhood parties, or what are you doing, and who's helping you during this time? Technology. I think this is probably the one area of support that we are accessing all other areas of support through. When you first started working at home, did you know how to use Zoom? And I know some of you didn't, because you're my friend on Facebook and you posted things like, "I'm still trying to set up my Zoom account." And other people were posting, "I did mine in 10 minutes. And you're like, "I've been trying for an hour." So what technology did you have that you used? And then what technology did you have to learn to use? We've also learned during this time how important it is that people receiving supports have access to technology and use technology. I'm on the board of Ohio Self-Determination Association. Immediately on Facebook, people were posting, "I'm not going to be able to see my friends. We have a regional meeting. I get to see 100 people I know. I'm not going to see them. I have a Project STIR meeting. I'm not going to see them." And so OSDA worked with the Nysonger Center at The Ohio State University, and Tracy, who's helping facilitate this call, developed some awesome resources. And I'm going to show you a link in a minute. We have to remember that access to technology is a right for people with disabilities. And our approach should not be, "Yes, but they don't have it. Yes, but how do we fund it? Yes, but I live in an area that doesn't have. We need to look at, and how can we? We know that when we look at technology, I heard someone, I was on a call the other day and somebody said, we probably should add technology to the assessment. No, 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 no. Technology is a means to reach an outcome or a good life. You do not just assess technology. You have to tie technology to an outcome or a concern. So when my mother and George had their strokes within 60 days, they both used cell phones. My mother was living with me, and I thought, my concern was, what will life be like when she comes back and lives with me again? What will life be like for George? Both of them were very independent. They could get through their day without help. They needed rides to places, but that was about it. And I had to look at, what is my concern with technology? My concern was, as some of you know, I used to travel and throughout the state. And my concern was, how do I keep in touch with them when I'm not physically present? Both of them could not remember how to use a cell phone, what it was for. And so I had to develop different routines and rituals and teach them. George used a Mac for engineering and financial programs. George could not remember how to turn on the Mac or what it was for. And to this day, the Mac is a useless piece of technology for him. But I have been able to teach him how to use the iPhone, to call me, to connect with me. And the only email he addresses is to me. I mean, I have to go in and delete his email because he doesn't use it. I also had to look at, life is different now. Rituals and routines have to be different. And people in the hospital were saying, you better think about a nursing home. You better think about. And I said, I can't think about any of that until they're home in their comfortable environment, and I can see if they can make it through the day. And then I looked at what technology will help in those areas where they need supports. And why did I want technology? Because technology also removes that personal nagging. And I thought, if I nag my mother all day, it's not going to be a good life for either one of us. Or if I have to prompt George all day, it's not going to be a good day. So what technology can I use so they have some control and I can put some parameters? So I looked at technology for medication, as we all do, but we need to start looking at technology as one of the maybe first places we look at for support. Can it help? Will it work? Can they learn? I will share the links to some of the simplified clear language Zoom resources that FRNO put out. So please use them. I've been on calls with people receiving supports who we had to talk through on their cell phone with their tablet how to get into Zoom. And I have to chuckle because the next week we had a meeting with one of the women that we had to coach through, and she got on before all of us and was like, hi, I've been waiting for you. So people can learn, and people have learned to use technology, Zoom, in so many different ways, which is very, very, very exciting when given the opportunity and the impetus. And this pandemic has really pushed us to look at technology. So it's not something we look at during assessment, but we look at when we're problem solving for supports. Community resources. How many of you are using community resources? How many of you are using delivery services? What are your Amazon accounts look like, or your online shopping? And we've begun to look at those resources that are available for everybody. And then the last area we want to look at is eligibility specific. How many of you are using eligibility specific supports? I'm assuming you all have healthcare. If you're employees, are you accessing your employee assistant programs? Are you accessing some of your benefits through your healthcare? Because of my age, because of my health insurance, I'm eligible for silver sneakers. I belong to my local Y, And I freaked out a couple of weeks ago when I got a call from the Y and was thinking, why are they calling me? They're closed. And she goes, we're calling all our Silver Sneakers members. We just want to see how you're doing. Do you need help getting groceries? And do you need help getting your medication? And it made me laugh because I thought I'm the one running out and buying groceries and medication for other people. But I thought it was a nice thing. Here's the example. 3 of the Ohio ambassadors, Corey, Celia, and myself, sat down at the beginning of COVID and really wanted to show how to use the integrated STAR to think of possibilities of support during COVID. Again, I want to remind you that we all want to feel valuable. And so a lot of my friends have struggled with, I feel hopeless, I don't know what to do, how can I help? So some of my friends in my church community have done things like texted me, I'm dropping off food and it's on your doorstep and let me know. And I'm like, I cook, but then I have to step back and say, people are trying to help, be gracious, accept it. How many of you are trying to find out, what can I do? Can I sew masks? Can I go visit people? My friend and her son, when he missed the people at the nursing home, did window visits. He's sending them little notes. What are we doing to stay connected to people or reconnect with people that maybe we've lost through, because we've been so busy at work, etc. So this is just an example to show you to think about possibilities. We need to think differently about what we do and how we help the people we support to also feel valued and contributing. This is a blank star. Some of you, I hope, have used it to brainstorm. In the middle, you put whatever the concern is or your outcome. And then in the 5 areas, you can either write what's current or you can split each area and write what's happening now, what needs to happen in the future. I will tell you that after George had his stroke, 60 days after my mother, I pulled out the star right away for me because I thought, caregiver for 2, trying to maintain my professional activities and also taking care of myself. And I kept saying, it's only me, it's only me, it's only me. And we hear that a lot from families. And as I started doing the STAR and looking at what else is available to support me, I looked at relationships, and the people I thought would help didn't. And the people that I wasn't sure about and accessed helped link me to other people who have been invaluable. So it's hard for families to think beyond themselves and to sometimes ask for help, but I think right now, that is something we are all experiencing. I've got to ask for help. How am I going to have childcare? How am I going to do this? What's going to happen? And the STAR may help you put your, organize your thoughts and do some problem solving. I really want to focus on the one-page descriptions or one-page profiles. The one-page descriptions, one-page profiles were developed by Helen Sanderson in the UK, and I've been using them for over 10 years. So I know it's been at least 10 years that she developed them. The person-centered thinking, the learning community for person-centered thinking adopted the one-page profiles, and those of you that have gone through the training, you know that we worked for having conversations and developing your own one-page descriptions. And then the Charting the Life course has included the one-page profile in the portfolio. On this slide, for those of you that have gone through the training, you see that there are many, many, many tools and resources you can use to gather the information to not only do your assessment, your planning, your monitoring or review of the plan, and also your review of quality assurance, as well as developing the one-page description using these tools and resources. This slide on the left, you see the example of a one-page profile that you'll see in the portfolio that we attached for you. This is just a model. You do not need to use this when you write a one-page description or profile. Whenever you write a one-page profile or description, you have to identify the purpose. Who is going to read this and why are they going to read it? You have to identify in your own mind before you start, what is the purpose? So when I talk about a one-page profile, I'm not talking about a summary sheet. I'm not talking about a demographic sheet. I am talking about one page that has these 3 headings on it. When we develop a one-page description, we develop it with the person using their what they tell us with their words and their actions. And those of you who know me know I am a speech language pathologist. I have yet to meet a person who receives support. I have yet to meet any person that someone who knows them or loves them cannot tell me what's important to them, how to best support them, that they know through the person's words or actions and actions. So it doesn't matter if the person can tell us with their words. We can ask people who know and love them and learn about them from their actions. We want to keep it simple. We want to use bullet points, not sentences. The reason we keep it at one page is anybody will look at one page that's bulleted, but they're not going to read an 8 to 80 page ISP. So this is a quick snapshot. You can use a Word doc with text boxes, and that's what I've done. So I haven't used this form or model. I typically use a Word doc with text boxes. And I always tell people to add a photo. Why? Because we want people to see who the human being is that we love or that we support. The photo makes it personal, and choose a photo that really captures who that person is. People are concerned about HIPAA, but I know some of the county boards write one-page profiles as a general introduction to people, and most people will agree to having their photo on it. I also think about healthcare workers who have put their own photo on their PPE so that patients can see who they are. So there's 2 ways I want to talk about using a one-page description. One is for new caregivers, people who are coming in and for emergency, if the person becomes ill, if their caregiver becomes ill, whether their caregiver is paid or unpaid. The one-page description has 3 sections: like and admire, important to, and how to best support. It tells us who the person is, not what they do, but who they are. And it is a human-centric versus disability-focused description. Under like and admire, we ask the person, what do you like and admire about yourself? What are you proud of? We want to know who the person is, not what they do. So we're looking for human qualities. I will tell you that when I've done this with people receiving supports, they usually use the same word to describe themselves, and it's, I'm nice. So I want you to think about a one-page description for yourself. If you had a new supervisor who was going to be your supervisor when you returned to work in a work setting, and some of you apparently have because I've seen photos, but if you were going to have a new supervisor, what would you want them to know about you? What qualities would you want them to know? Are you organized? Are you passionate? Are you eager to learn? What qualities would you want a supervisor to know? What qualities do we as family members love about the people that we love? What qualities do you admire about the people you support? Think about that. Under important to, I want to remind you, this is not a list of likes. This is not a list of activities. It's the things that are needed to make sure that the person feels comfortable, has good days, has some control, some consistency, and they're satisfied. You can either use the life domains from Charting the Life course, which I have not listed, or you can ask, who are those people? that they have relationships for. You're looking for detailed information, not family and friends, but who. Because the reality is you and I do not like everyone in our family equally, and they are not equally important to us. What's important to them, to do, to have, to go to, their rituals and routines. We have all experienced changes in our rituals and routines. What have you kept in place because it's so important to you and it helps you get through your day? And what's important to them so that they are valued and they have the life they value, their meaningful life, not meaningful activities, meaningful life. So how to best support me? Think about a new supervisor. Important to you. Oh, let me go back to important to you. I'm sorry, for a new supervisor. What do you want a new supervisor to know? Do you want them to know that you need time first thing in the morning to organize? Do you want them to know that if they're going to schedule time to talk with you, that you would prefer afternoon meetings? Do you want them to know that you want to do a good job? Do you want them to know that it's important to you to help others do a good job? What is important to you in your work role? Let's go to how to best support. So what do we need? What do people need to make sure they get through their day smoothly? It's not a direction, it's not a list of needs. You know, they need help with ADLs. Whoop-de-doo, if I were walking in the door, I wouldn't even know what to do. When I had people help my mother and George, I had to list, this is what you need to do. So here are some possibilities. When one woman said for her boss, she wanted her boss to know that when he's teaching her something new, tell her, show her, watch her do it, and tell me how I'm doing. Don't wait to find me doing it wrong and then tell me I learned it the wrong way. You can also relate to other documents. Follow the behavior support guidelines. Don't tell me what to do, give me 2 choices. Remind me to wear my headsets. Don't talk to me like I'm a child. What do you want your supervisor to do? Best support you. Only schedule meetings in the afternoon, or don't schedule before a certain time. Tell me what to do and give me time to figure it out. Don't micromanage me. Give me feedback, especially when I'm learning something new. What is it that will support you? So for my brother, look, this is his 1-page description. You notice there is nothing about his disability on this piece of paper. It says Nick the Greek because from the time he was a young child, he wanted to be called Nick the Greek. I found that out when I picked him up when he came back from camp, and they said, you're NTG's sister. And I said, no, I'm Nick's sister. And they go, yeah, NTG. And I go, who is NTG? And they said, Nick the Greek. So I learned I had a brother with a different name. But you see the things that someone coming in needs to know about him, what we loved about him, and some immediate things on how to best support. We also, when you're writing one for caregivers, like the one I just showed you for Nick, remember it can be a Word doc. Some people, for caregivers, they like to put icons or symbols. So you'll see icons of Brutus. You'll see pictures from the Cleveland teams, the Cincinnati teams, and even that team in Pennsylvania that some of us from Northeast Ohio don't really talk about. But you'll see things that make it personal, that's relatable. You can, and please make sure you have multiple copies. Some of the families I know who have written one for caregivers because they're concerned if they become ill, have actually posted it by the door. So when someone comes in the house, they see it. Please, please, please use a photograph. It makes it so much more human-centered and not client-focused. And some people receiving supports have told me they have put their 1-page description in a frame and have it hanging up in their house. And when someone new comes in to help them, they take them over to the frame. So for hospitalization, same format, same 3 areas, put a photograph always have several copies, and this is helpful whether or not you are going to be at that bedside and keep a vigil. Both my mother and George have been in the hospital several times in the past 2 years. Thank goodness the hospital is 1 mile away, but I was not always there. And even if you are, I'll never forget the day I left to go use the public bathroom, and that's the time when the doctor came in. And George cannot remember, he cannot relate what happened, he cannot answer questions, and so I was frantic. I also tell families, if you've got a go bag, which I know Parent to Parent has emphasized, make sure you have a notebook in there. When anyone walked into the hospital room, I would open that notebook and start taking notes, and that shifts the power in the room from you're depositing information to me to I am listening and I am keeping track. So we want to focus. We know those caregivers in the hospital are busy. We want to focus on what they need to know. I'm not going to talk about like and admire because you've already identified those qualities. But what's important to the person in a hospitalization so they feel safe, comfortable, valued, respected, and content. I want you to think about if you had to be hospitalized and no one could be there that knows you well and loves you, and you were unable to communicate. What would be important to you? I had to make sure that both of my family members had cell phones and the charger. Oh gosh, the charger. And that the charger, if it had to be charged, it could still reach them in the bed. So all sorts of things to think about. Do you want to be told what's happening? Do you want people to introduce themselves? Do you want the chaplain to visit? I have a friend who's a chaplain, and right now she cannot go in a hospital room unless she is specifically asked by the patient or the family because of the concern about transmitting things from room to room. What things do they need to have? Now, please know, healthcare providers, if someone is has COVID, if they're in isolation, if they're in ICU, people may not be reading this, they may be rushing in, rushing out, but at some point during that hospitalization, hopefully they will be in a setting where information will be, it'll be easier for caregivers to look at. Do they need to watch a certain channel on TV? That's a silly thing, but think about it. My mother's in a nursing home right now. The day before the COVID shutdown, I went to visit her, and a staff member ran up to me and said, "Please don't be mad. You're going to see something in your mother's room." And I'm like, "What?" And she said, "There's a sign." And I thought, oh my gosh. And she proceeded to tell me that staff were talking about how Melanie was having a bad day. When she went, she said, "But I get along with your mother." So I went in and I said, "Melanie, how you doing?" And your mother didn't shoo me out or point to the door. And then I realized the TV was not on Fox News. And I said, "Melanie, do you want me to put the Fox News on?" And my mother just looked at her. The remote was in front of my mother. My mother did not remember how to use it. She put Fox News on, and my mother's demeanor changed immediately. And she said, "So I hope you don't mind, there's a sign up that says don't change the channel from Fox News number 14. That made a bad day for my mother and for the staff. So what's important to know? How to best support, show him how to use the call button. For my brother, he could not use the typical call button, so I'd have to ask for a plate switch. How to position them, what to do if they're anxious, how to give medication, who to contact if they need to make a decision, who do they talk to, and how they might express pain. These are just suggestions to think about. So here's one for my brother for hospitalization. And I realized when I was preparing this that I used the pronoun I, and that's because Nick told me. So I should have put it in quotes, but don't ever use I or me unless it's coming from the person. But look, if he's in the hospital, he wants to talk to me every day, here's my phone number. Make sure you tell him what you're doing. He wants to see the chaplain or the priest. Ask him yes, no questions. My brother used a laptop with voice output. We could not position it so he could access it when he was in the hospital. So we had to look at other ways for him to be able to communicate with the medical professionals. And the other thing that we learned, and we learned these all because of things that happened that were not so good, but even though I gave the staff information in writing and so did the provider, that information was not used when someone walked in the room. It was not accessible to them. So I tell people, tape it above the bed. Put it in a plastic sheet, tape it above the bed. I put it on the bed tray and it got covered. So make sure it's visible. And something that was very critical for my brothers, people would come in and go, Nick, what's your pain level? And I had to keep telling him, he can't feel pain on his right side. He cannot feel pain, so you're not getting a good assessment. All you know is what's happening on his left side. I want to show you some more one-page profiles that were developed by the learning community for person-centered practices and support development associates, where Michael Small is the senior partner. And you have these. This is for Sam. You see that the picture happens to be Sam with his two daughters, so it immediately conveys something of importance that people need to know. Who are those two? And I also will tell you that healthcare providers coming in the room, when they see this, that it also gives them conversation starters with patients, so they can also be a little more humanistic. He's a jokester, and his daughters are very important to him. So you see that the best way to support, they put 5 bullet points. Tell him what you're going to do before you touch him, or else he might strike you. That's important for doctors or nurses to know, because I know I've experienced where that happened with a family member, struck out because they didn't say, I'm going to do this. And what happens is then the whole attitude towards him as a patient changed. And I had to deal with some issues. Not going to go there. But how to distract him. Talk about feeding birds or growing plants, and give him his meds and chocolate pudding. For Martin experienced a traumatic brain injury in his teens. He's now in his 30s. It is critical that he talks to his mother daily. There's her phone number. Don't tell him to stop smoking. Make sure he can listen to Christian rock if that's available. Make sure his phone is charged and available to him. And make sure he's got his walker at his bedside, because if he needs to get up and the walker is not there, he may fall. He's a fall risk. This is, oh my goodness, Jim. And I think what's important, again, who to call if he needs to make a decision. Having a large pop, Mountain Dew or Pepsi, and I know some of you are going to say the hospital will not let people have it. Sometimes you just have to tell people, if this is not there, if they don't have this, your days are going to really be bad. So I will bring it in. You do whatever you need to do, but I'm going to bring it in. And he's a smoker and he needs a nicotine patch. So very clearly, this is how to support him in the hospital. Very clear, very white space, no other fancy anything on it. I'm sharing with you a medical form from Stony Brook, and I will tell you why I'm sharing this. There are lots of medical forms around. Doesn't matter what you use, but I like this one. Stony Brook University out of New York has medical forms that are for every state that they've developed. I love this for a couple reasons. Up at the top, it says, do you receive or have you received services from DODD? So immediately people see, oh my goodness, this is someone who's got supports from another system. The questions on this page also give information, not about diagnosis, but how do we support you? How do you communicate? Do you need anything when you communicate? How do you respond to typical medical interventions? What are your triggers so we know how to support you? You have a copy, so I'm not going to read it to you. On page 2, what I really, really, really love is a lot of the medical forms I have seen say, do you have a guardian? Yes, no. Do you have a DNR? Yes, no. And some of you who have had those bedside vigils with people you love, know that there's other possibilities in Ohio that people can use supported decision-making. Now, it says supported decision-making team because that is a system term. That is not the right that people have. In Ohio, our rules support people to have supported decision-making. We all use supported decision-making. The minute you open your mouth and say, I want to talk to my spouse, my parents, my family members, a friend who's a doctor, I want to get another opinion, that is supported decision-making. You do not, supported decision-making is not a process that has to be formalized. It's not a procedure. It is not a program, and it is not a piece of paper. It is a way that we make decisions. The other thing I love about this form is it doesn't just limit to do you have a DNR or not. It actually asks you about advanced directives. Do you have a POA, a power of attorney for medical care? And gives you some examples and some information so people can make an informed decision. The other resource I've seen shared a lot is the health passport from Florida. A lot of white space, some icons or symbols to make it more meaningful. Again, you can find it on the internet. It's easily downloadable and printed. I think it's on the parent-to-parent website also. I've heard Amy and Lynn talk about it. It's been shared throughout the disability community. You also may have your own medical forms, and that's okay. Some health systems, I know my mother and George get health care both from Cleveland Clinic and university hospitals. We get summary statements every time we have an appointment or a hospitalization. Also, they have electronic records, and those two systems, along with Metro and Cleveland, can access each other's electronic records. You have the Stony Brook, the Florida. You can have whatever form works for you. Just make sure you have multiple copies and make sure that the information is current and up to date. I also take a snapshot of the current meds for George, so I always have it and can check it with the form that they give us before appointments. So you have a lot of resources. The Family Resource Network of Ohio, DOD, is posting a lot of information for families and professionals. The health passports, charting the life course, and one-page descriptions. And I am going to look at chats. Do we have questions? It's gonna take me. So yes, people got them in the email. The slides, you've got them. You've got the slides. Anything else that I haven't answered? We are just coming up on, I think, 10:55. I hope I didn't talk too much. Yes, oh, Autumn, thank you. Yes, we need, this is our mental model. I love that you put it that way. I just want to say that any barriers, any yes buts are not because of charting the life course or person-centered thinking. It is in our own mind, our challenges that we need to deal with before we support people to have control over their lives and what can be done. Okay, and I know that you all have changed your life. You are doing awesome work to help people have the life they want and value and connect with people in whichever way they can. But as we all know, the new now is going to be very different, or the now current, I'm sorry. The now current is going to be different, and we may have to look at different ways to help people have the life they value.
Barb, you have a question from Jason that he might want you to expand upon merging PCT with supported decision-making.
Okay, Jason, whoops, did I do that? Did I end the show? Jason, in person-centered thinking, we want to empower people and give them all that, make sure all their rights are in place. We know some people do need guardians. but we know that lots of people don't. And if they have people around them that can support them, I always, on my brother's plan, every year they'd ask me, do you want to be guardian? I'd say no. Do you want to be guardian? No. He asks, he reaches out, and I made sure in the plan it said, when Nick needs to make a decision, help him contact his sister. I also tell people that you have time to think things over, and often as professionals, we want you to answer right away. And there is no question that anyone has to answer right away other than whether to call 911. And people are not going to ask you permission. So supported decision-making is something we've heard from Jonathan Martinez, who is the guru of supported decision-making in, I don't know if he's in Maryland or Virginia. And he has told me, because I have asked him, in Ohio, people with receiving supports, people with disabilities have the right of supported decision-making. It doesn't have to be formal. I don't know if I'm answering your question. Please, you can call me. My cell phone's off now, so it doesn't interrupt the webinar, but you can email me. I'm passionate about this and passionate about supporting my mother any way that I can, even though I do have POA over her and my partner. But the challenge for me is to maintain their dignity and their involvement in the decision-making instead of just jumping in and doing what I think. Please contact me if I'm not addressing it, because this is a discussion that could go on for another hour. Oh yeah, Jason, I don't have closed captionings. That's why I tried to put as much as I could on the slides. Any other questions? Okay, let me do some housekeeping, and please, you have my contact information. Please feel free to contact me. You will be getting a survey at in your email. Please complete it and return it. It'll come from NYSLONGER, FRNO, Family Resource Network of Ohio. You need to return, once you return that survey, you will get a certificate for 1 hour CEU. And I think that is the closure. So look for that email with the survey, return it, and then you'll get in email a certificate. Is there anything else, Tracy? I see we're at time, I think. I thank you all for joining. Good luck. And, oh, I'm sorry about the echo. Oh, shoot. Good luck. And please, also another thing, share with us how you've used the tools. We're looking for examples that we can share with people. So please share them. You can email them to me. I'd be happy to share it with you, share with other people so we can all learn from each other. So I appreciate your time and your attention. Have a great rest of your day. It's sunny in Cleveland, so I want to get out and enjoy the sun before it rains again. Take care, everyone. Be safe and take care of yourselves. Bye-bye.
Thank you so much, Barb. Just so everyone knows, we will send out that survey email, but we will also reattach the links to the slides and the other forms that Barb presented today, as well as Barb, I think we can go ahead and attach those Zoom instructions as well.
Oh, awesome. Awesome. They were so helpful. So that's awesome. Great. Thank you. And I am copying Jason's email. Got it. Jason, you can email me too, please.
Thank you for attending, everyone.
Okay. Bye-bye.